This is the Easy Guide to Medical Research Part 1. My main goals are to demonstrate the template that most medical research follows and to demystify the statistics by using online calculators that anyone can access. So what template? First, you want to decide what you want to study. You choose your population, you gather their risks, and hopefully you show that the two groups are equal at the beginning of the study. Then you enter the variable that you want to study, and then you evaluate whether the outcomes differ. So what are you studying? Is it common or is it rare? Can you sample the whole population, or is the condition rare such that you need to focus on at-risk populations? An at-risk population will give you more cases, but it adds selection or sampling bias. So for this lecture, I'm going to focus on preeclampsia. And so who gets preeclampsia? I have a little hint here. It's pregnant ladies. So what are the risks of preeclampsia? It's important that you know the risks of your outcome, and the reason is that these become the data that you need to get from all of your participants. And the reason is that you want to make sure that their risks starting out are equal. So let's look at chronic hypertension. Chronic hypertension is a substantial risk factor for preeclampsia. And when you have two groups that you're going to compare, neither group can have more or substantially more chronic hypertensives. If they do, then they're automatically going to have a greater risk of preeclampsia at the end. And so whatever intervention you did, you're not going to be certain if that's why they had more preeclampsia or if it was the fact that that group had more chronic hypertension. So you need to gather this data on all your participants and hopefully show that it is balanced at the beginning of the study. Now note that some of these are in white and some are in orange. And the reason is that as I'm looking at these, there are some that I'm going to include. Those are the ones in white. And the reason for this is obviously I want to have patients who wind up with preeclampsia, and certain things are common and I'm going to want to include those. But some of these may be uncommon. And if I include them, it's very likely I'll get 2 in one group and none in another group. And those small numbers will show statistical significance, and that will show an imbalance, and I won't want that. And then some other reasons are that some of these are complicating and they can be confounding. So as I'm looking at this list, I'm looking at what I want to include and things that I want to exclude. So these risks become the data that we need to collect from our study patients. And so we want to know, is anyone over 35? Well, we need to collect each patient's age. Do my patients have chronic hypertension? And how do I enter this data? Do my patients have diabetes, nulliparity? This would be they've never had a baby before, or rather this is their first baby. The body mass index. And in prospective studies, conditions with substantial risks may need to be actively distributed between the groups. But when you do a retrospective study, you kind of get what you get. And unfortunately, you often wind up with some selection bias in retrospective studies. So let's look at some of these variables, and we're going to see which are continuous and which are dichotomous. Now, there are other kinds of variables, but these two, continuous and dichotomous, make up a substantial portion of medical literature. And so if you can know these two variables, you will understand a great deal of medical literature. So age is a number. This is a continuous variable. Chronic hypertension, you either have it or you don't. It's a dichotomous outcome. Diabetes, you either have it or you don't. Nulliparity, it's either her first baby or it's not, meaning she's had babies before. Body mass index, this is a continuous. This is going to give you a number. So as you enroll patients, you might put them in spreadsheets like these. So these are just two groups that I've completely made up. This is not real data. And this is the F group and the G group. And in each group, I have 6 patients, and I've put in their ages. And then at the bottom, I've calculated the mean. And here, chronic hypertension, patient 1 does not have it. She gets a 0. Patient 2 has it. She gets a 1. And then at the end, I'm going to add them up. And 3 ladies in this group have chronic hypertension out of 6. That's 50%. and likewise in this group. So continuous variables. Continuous variables are any variable that you can put on a number line. It can be any number, a negative number, 0, it can have a decimal, it can be a very big number. So now I've got two made-up groups of 10 ladies, and these are their ages. And remember that age over 35 is a risk factor for preeclampsia. So I need to make sure that neither of these groups is substantially older. So how do I compare them? The answer is with a student's t-test. And this slide, I'm putting this here really just to remind you that you can investigate this as you see fit. But for this lecture, we're going to use online calculators. So if you do an online search for t-test calculator, you will get a list, and here are 3 possible examples. And what's amazing is you can put in this data, and it will tell you the mean of the two groups, the standard deviation, and it'll give you a p-value. And I like to say it's like magic. So here is an online t-test in action. This is the GraphPad t-test calculator. And for our example, we have 10 participants in each group. And so we are clicking here, enter up to 50 rows. But note that you can enter up to 2,000 rows, so you can really have rather large data sets and use this calculator. We are choosing an unpaired t-test because we have 2 sets of individuals that are not related. A paired t-test is when the 2 sample sets have overlap. So it could be twins or siblings or potentially a group of participants before and after treatment where they're the same people. That would be a paired t-test. But we have 2 sets of 10 individuals that are not paired in any way. So I've already entered in the ages here and here. I could label the groups, but I have not. And then we hit calculate. And so then GraphPad tells us our p-value is 0.25 and that this is not statistically significant. It also tells us the mean of each group, the standard deviation, the standard error, and the number in each group. I should point out that typically a t-test is used for groups of 30 or more. However, for this example, I have 10 participants in each group. So now what about dichotomous variables? These are variables with 2 outcomes. Typically yes is a 1 and no is a 0. So now I've made up 2 groups of 100 women, and we want to know how many have chronic hypertension and express this as a fraction. So in group 1, 45 women have chronic hypertension, and in group 2, 37 out of 100 in both groups. How do we compare these groups? So again, remember that chronic hypertension is a substantial risk factor for preeclampsia. So I want to make sure that this group doesn't have too many chronic hypertensives and show that it does not in comparison to this group. And once again, I have some beautiful artwork from an autistic scholar. So the answer is to do a chi-square test. This is also known as a 2x2 contingency table, and for small sample sizes, a Fisher's exact test. Again, you can search online for a chi-square calculator or a 2x2 contingency calculator, and you'll get a list. I tend to like Vassar stats. Again, this here at the bottom is just to show the background into the chi-square test, and you can look into this as you would like to. So this will be your first chance to play along. You can open this QR code, or you can type in this website. This is the Vassar Stats 2x2 contingency table calculator, which will give you odds ratios, risk ratios, chi-square test, and Fisher's exact test. It also will give you a little bit of information here and background if you're not certain how to do this. So if you're following along, these yellow squares are where you put in your data. And in our first group, we have 45 women with chronic hypertension out of 100, so 55 do not have it. In our second group, 37 have chronic hypertension and 63 do not. You'll press calculate, and for your information, this is set up for an odds ratio. However, we're going to get to that later, so don't worry about that just now. And what we really want to know is our chi-square test. This is how we're going to compare these two groups. If at all possible, you use the Yates continuity correction. and our p-value is 0.31. So if you were to pull up a research article, you'll typically find a table, and it's usually table 1, which will go over the patient risk factors. So this is all hypothetical, and this is based on 2 study groups that are both pregnant, and we're going to look at the outcome of preeclampsia. And to one group, we've offered them some treatment. I don't know what it is. It could be a vitamin, it could be an exercise program, it could be anything. And in this group, we did not, or we gave them a placebo. And so you're going to put all of your risk factors, and of course there'll be more than this, but you'll get the idea here. And typically it's called patient characteristics, maternal characteristics. So group 1, our treated group, the age in years, the standard deviation, and the placebo group, and here's our p-value. And unfortunately, our placebo group is older, and we will have to put that in the discussion. And then going to chronic hypertension, which we just looked at with the 2x2 contingency table. Again, 45% in the treated group and 37% in the placebo group, and this was not different. And then here are some possible numbers for diabetes and nulliparity. And if you want, you can go through the 2x2 contingency calculator and check these values. So we're going back to our template. We decided what we wanted to study, we chose our population, we gathered their risks, and we showed that they're equal, and we're right about here. So we're going to enter the variable we want to study, whatever it is, and then we're going to evaluate the different outcomes. So to recap, we learned that comparison groups must start out with similar risk profiles, and we learned how to compare risks given as either continuous or dichotomous variables. So now we're going to compare the outcomes using similar principles, because outcomes are often continuous or dichotomous variables. But unlike risks, where we hope to show no difference, with outcomes we're hoping to show a difference. So going back to our hypothetical research study, these are the outcomes that we chose to look at. In our treated group, 12 developed preeclampsia and 18 in the placebo group, and there was no significant difference. And then we decided to look at the average gestational age of when they developed preeclampsia. And in our treated group, it was 38.2 weeks versus 36.1 with the standard deviations. And this did show statistical significance. But remember, our placebo group was a little bit older, so you'll have to kind of factor that out in your discussion. And then we looked at preterm preeclampsia, whether it developed before 36 weeks. Remember, this is a dichotomous value. It either happened or it didn't, yes, no. And 4 in our treatment group, 7 in our placebo group. And it's nice to use 100% because we can easily show the percentiles, and the p-value is not significant. If you want to go back to that prior chart, you can then open these QR codes. This is GraphPad and this is Vassar and you can check my data. And that's really nice. These are awesome ways that when you pull up a research article online, they will often give you the mean and standard deviations of the 2 groups, and you can go to an online calculator and check their outcomes. We went over how to do this with Vassar with GraphPad. So if we were looking at this gestational age in weeks in the prior table, you would use this entry format where you enter the mean, standard deviation, and number, unpaired. And here I've put in the data, and then you would hit calculate and you would check my results. So big take-home points. The 2 main types of variables that both describe risks and outcomes are continuous variables and dichotomous variables. Continuous variables are numbered data. They compare the means. You use a student's t-test. You should have over 30 participants in each group. Dichotomous variables answer a yes-no question. You compare fractions or percentiles with a chi-squared test. For small data sets, you use a Fisher's exact test. And I mention these 2 variables because by far they are the most widely used, and if you can master them, you'll really have a good understanding of most medical literature. So back to our template. We decided what to study, we chose our population, we gathered the risks and showed hopefully that they were equal. We entered a variable, and then we evaluated different outcomes. For part 2, we'll look at prevalence, incidence, odds ratios, and risk ratios. And part 3, power analysis and putting it all together. A few last disclaimers that you can read on your own. Thank you very much.